Hi everybody, I'm Dr. Kira Groves. Welcome to our health seminar with Lake Charles Memorial. Today we're going to be talking about women's sexual health. I hope you're excited, and I really am. So today I'm going to tell you about myself first, and then we're going to talk about women's sexual health, barriers to women's sexual health, and what help there is and how your doctor especially can help you out. So first, who am I? Well, my name is Kira. I grew up here in Lake Charles, moved away for a little while to go to medical school, so I am a medical doctor. I practice family medicine. I finished up family medicine residency up in North Carolina, and then just this past year I moved back here and signed up with Memorial Medical Group over on Astor Street. I am obviously a woman. I'm a mom and a wife, and I'm someone who's really passionate about helping other women have their best life. Feel good, be what you want to be in life. A really important part of that is our sexual health. Obviously, sexual health is not something we talk about a lot in our community. We don't usually get together with our friends and chat about how we're doing sexually. But it is a vital part of each and every person's life. Whether or not you are sexually active, you still have sexual health needs. So today we're going to talk about them a little bit. We're going to talk about, like I said, what are some barriers to sexual wellness that women experience? Often, because we don't talk about sexual health, we don't acknowledge those barriers, and women can be left feeling very isolated and very alone in dealing with their issues. So today we're going to try to bring some things out into the open, talk about them in a professional but clear way, and hopefully give you some insight into things you or others may be experiencing. We're going to talk also practically about some things you can do to improve your sexual health. We'll wrap up with some tips for improving your sex life today, and we'll leave some time for questions at the end. If you have questions while I'm talking, please put them in the comments below, and we'll get back to them at the end of the message, okay? All right, today I want to start out by saying I am going to use the term woman in women's sexual health. I know that there is a lot of cultural question around gender identity right now. This is not going to be an identity term today. This is going to refer to a person who is biologically female and an adult. Now, however you choose to identify or any of the other things you think about being a woman, today I'm referring to a biologically female person who's an adult. I'm not going to get any more into the politics or gender studies of that. I know woman has a lot of social implications and a lot of different meanings for different people. I just mean an adult female human being. So sexual health. What do I mean by sexual health? Well, we're going to be talking about the physical, the social, and the emotional aspects of sexual well-being. Like I mentioned before, I am going to use professional, straightforward, biologic terms. These are appropriate for any adult, but parents, if you have a child listening and you don't think they're ready for a straightforward discussion of male and female anatomy and biology and the straightforward mechanics of sex, then this talk probably is not for them. So parental discretion advised. There will be nothing in any way pornographic or explicit or anything in this discussion, but we will use some straightforward terms in discussion. All right, so let's jump right into it. What is sexual health? I'm going to read y'all this quote because it's my favorite quote about sexual health. It says, "Sexual health is a state of physical, emotional, mental, and social well-being related to sexuality. It's not merely the absence of dysfunction or infirmity. And female sexuality has been recognized by the World Health Organization not only as an important component of women's health, but also as a basic human right." So I love this quote because it recognizes all the aspects of our personhood. We have physical needs, we have emotional needs, we have mental needs, and we have social needs. And all of them come together in our sexuality, whether or not we are sexually active and whatever our gender or identity might be. Unfortunately for women, often our sexual health is not, like I mentioned, discussed very much, but it is a basic need and a basic right. Why is it so important that we do bring this out in the open and talk about it? Well, that's because so many women, as we don't talk about it, have problems and then don't get help for those problems. In multiple surveys, over 40% of U.S. women report suffering from sexual problems and dysfunction that is causing them distress. That is a huge amount of women. 4 in 10 women in America are suffering from problems like those we'll talk about today. If you are one of those women, I hope you know that you're not alone, that what you're experiencing is not shameful or somehow your fault, and that there is help out there for you. Women who do suffer from sexual dysfunction and sexual problems are much more likely to have problems in other areas of their life, whether that's the cause or the effect. Women who do not have a satisfactory sexual life or good sexual health are more likely to have mood problems as well, more likely to become depressed or anxious even if they weren't to start with, and more likely to have unsuccessful relationships and marriages. There's a direct correlation, unfortunately, between women who are unhappy sexually in their marriages and then going on eventually to divorce. So husbands, if you happen to be listening today, this is really important for you. If you'd like to stay a husband, your wife's sexual wellness matters a lot. So that said, what can we do to improve sexual health? What predicts good sexual health? Well, the predictors of sexual satisfaction are being physically healthy. There's no surprise there. Any part of our wellness is improved by being physically healthy. But it's true in this too, being mentally healthy. So again, I mentioned that depression is related to sexual dysfunction, and either can cause the other. Depression or other mental illness can definitely lead directly to sexual dysfunction. So physical and mental health are huge parts of sexual health. And then the other hugely important factor, the other really main factor, is the quality of your relationship with your sexual partner. Whether it's your boyfriend, your husband, a casual partner, the quality of your relationship with that person is the biggest driver of whether or not you have a sexually satisfactory and a sexually healthy relationship. So that kind of covers these, but the components of sexual health are the physical, and that includes your medical and your mental health, and using safe sexual practices. That's a part of physical sexual health as well. Relational, like I just mentioned, is really the driving part of most of sexual wellness. Having a healthy relationship with a caring and respectful partner is vital to sexual wellness. Another part of sexual wellness for women specifically is family planning and fertility planning and contraception if you choose to have contraception. We cannot divorce female sexuality from pregnancy. So having an understanding of how sexuality and pregnancy are related and having a plan for those things is a vital part of women's health. And then the final part of women's sexual health, and the part I think that we talk about the absolute least, is enjoyment. Yes, enjoyment of your sexual life should be there. The ability to experience and enjoy sexual intimacy is a vital part of sexual well-being. And I know many women, unfortunately, surveys show, do not experience that. There are many women who don't ever orgasm during their sexual relationship. There are many women who report not enjoying or being afraid of or feeling pain during sex. And if you are one of those women, I want you to know that I am very sorry for the experiences you've had, that they are not normal, that they are not what you should hope for. You should hope for so much more, and I hope that at the end of our talk today, you'll understand a little bit more about how to get there. So that said, what are some of the barriers to women's sexual health? Let's jump right into them. The first and one of the most basic is a lack of quality sex education. When I say there's a lack of such sex education, unfortunately, that's not exactly true numbers-wise. 95% of teenagers receive sex education in high school. 95% of men and women report having had formal sex education before they reach the age of 18. Unfortunately, studies also show that sex education isn't working very well. It's obviously a very widely varying quality depending on where you receive your sex education. And we know that just many people after they report they received sex education still lack any basic understanding, especially of female anatomy, of safe sexual practices, and of the normal female sexual response. That given this is an anatomic diagram of the female genitals, so I understand if that makes some people uncomfortable. But I want to point out in this, 50% of men who were surveyed in multiple large surveys could not find the vagina on this diagram. That makes me very concerned for their sexual partners and makes it no surprise that plenty of women are not enjoying their sexual encounters. Unfortunately, high numbers of women also could not correctly identify all of the different things on this diagram. I'm going to go over them very briefly because a very basic understanding of female genitalia will help with the rest of our talk. Obviously, at the very middle, where it says vaginal orifice, that is the vagina. The vagina is a muscular tube that leads from the outside up to the uterus or the womb. That's where the penis would go during insertive sex, during intercourse, and it's where a baby would come out of when a woman has a baby. Around that are the labia, or the lips, They are a smaller pair, and then there's a larger fleshier pair on the outside. And above the vagina, there is the urethra. That's where urine comes out of. For men, sperm and urine come out of the same place. For women, sex and babies and things do not come out of the same place as urine. The urethra is what connects to the bladder, and that's where urine comes out of. As you notice, it's very close to the genitalia, and that's why many women can get sexually induced urinary tract infections. You know, sex can cause irritation there and cause urinary tract infections. And then, rather importantly for women, up above the urethra is the clitoris. This is an area of erectile tissue. That sounds kind of strange for a woman, but just like a man's penis can become erect, this tissue on a woman also becomes filled with blood and very sensitive. It has the most nerve endings of anywhere on any human's body. It is incredibly sensitive, and it is the area in women most correlated with sexual response. This is where most of women's sexual stimulation happens. All right. So, given that people can't even identify, normal female genitalia, obviously there is a problem with sex education. What's the answer to that? The answer is better sex education. And there's a lot of disagreement about how that needs to happen. Does it need to happen in school? Does it need to happen at home? I don't have all the answers for that today, but it is definitely a problem. And if you feel like, after what we've just said, that you have a lack of understanding of just basic sexuality for men and women, I would definitely recommend some follow-up research on reputable sites. Things like WebMD or the Mayo Clinic's, basic women's sexual health, basic men's sexual health. At the end of this talk, we will have some links posted that you can follow up on. So the next barrier to women's sexual health, once we've established a basic understanding of what's happening in sex, is wrong thinking about sex. Unfortunately, many things can contribute to this. It can be cultural, it can be educational, it can be religious, it can be personal experiences. Unfortunately, even right-minded or in things that are intended to be helpful and teaching can later cause dysfunction with sex. Sometimes people really struggle with this. Some examples of this are the purity movement among Christians in America. There's absolutely nothing wrong with waiting for sex till marriage, but unfortunately, a whole generation of young Christian women received the message that sex is something to avoid at all costs. It wasn't worded quite like that, but it was, you got to keep guys off of you, and it's your responsibility to avoid sex until you're married. And then those young women got married and said, wait, I thought sex was something I'm supposed to avoid. How can I figure out how to enjoy this now? And it really led to a lot of sexual dysfunction among a whole generation of young women. There are other many equally intended to be helpful thoughts or ideas or cultural practices that end up leading to sexual dysfunction. If you have trouble with your thinking about sex, probably the absolute best solution is therapy. There are many good therapists who can work with both individuals and couples to work through their relational issues and their thinking about sex to help them achieve a happier relationship and a better sexual relationship and more sexual wellness. A couple of ideas that I want to address today, because I think they're some of the foundational ideas about women's health and women's sexuality. I want to address the right idea. What is the right way to think about this? So, what is sex? Obviously, intercourse is when an erect penis is placed inside a vagina. Usually there's some sort of stimulation until the man ejaculates. That's intercourse, but that's not sex. And we need to broaden our understanding of what sex is. Sex is intimate physical activity up to and including intercourse, but it has lots of other aspects. And people that limit their sex life to only ever intercourse may not be enjoying it the fullest that they could. Again, the enjoyment there is a very important part of the thinking about sex. If you're listening today, if you don't take much of anything else away, I hope you take away that women can and should enjoy their sex lives. The average woman, I know that's completely contrary to what some women have been taught, that sex isn't for you, that women just don't enjoy sex like men do, that women maybe don't even really orgasm, and none of that's true. The average woman, in fact, 9 out of 10 women, can completely enjoy sex. They are able to move through a progression of sexual desire to sexual arousal to orgasm when they're given the right setting and the right stimulus. That is key, though. But again, most women, 9 out of 10 women, can enjoy that experience just fine. Now, there are about 1 in 10 women who have physical or other problems that will prevent them from being able to enjoy that. Many of those women have options and resources that could return them to a better state of sexual health and let them enjoy their sexuality more. However, some people are not enjoying sex. They have either unenjoyable sex, they have no interest in sex, or even painful sex. And that is a huge problem. That is a huge barrier to sexual wellness. Even if you think, I don't really have any problem, I just don't like sex. Well, if that doesn't cause you any distress and isn't causing a problem in your relationship, then it's fine not to want to have sex. But if that's something that's causing you distress or is damaging a relationship, then it is a problem, and it's something that can be addressed. There are a lot of causes for these issues. Just strictly not enjoying or being interested in sex. Again, there's a wrong thinking about this, that women just want sex less than men, or women like sex less than men. That is not necessarily true. There's no evidence that women have lower sex drives than men. There is a lot of evidence that women have been given really bad sex. So if you are in the camp right now where you say, I just don't like sex, I would encourage you to revisit that with an open mind and say, is there sex that I could like? Could sex be better and I would enjoy it? Or is there something mentally or physically that I can improve so that I can get to a place of sexual wellness and enjoyment? Some of the causes of not enjoying sex are mental causes, like we mentioned before. Mental health is a huge part of sexual health. So both actual psychological diagnoses like depression or anxiety, those have an enormous impact on sex drive and sexual enjoyment. And so if you have untreated anxiety, depression, or any other mental disorder, it is going to have an impact on your sex life. And getting that treated is going to be key to moving forward with healthy sexuality. However, even things that are not a mental disorder or a mental problem per se can definitely affect your sex life. Stress, distractions, all of those, if you're not in a place where you could enjoy something else, then you're not going to enjoy sex. If you're not in a place where you could settle down and read a book you like or eat something you enjoy, then why would you enjoy sex? It's not any different. So if you're in a place where you're so stressed or distracted and your partner is ready for sex and you're not, it's not because something's wrong with you. It's because you weren't ready. Relational causes, obviously, at the same time, can be a huge problem in sexual enjoyment. There is a direct relationship in studies between a woman's comfort and intimacy with her partner, how close she feels to her partner, whether she feels emotionally close to him, and whether or not she enjoys sex. So if you are saying, well, I don't really like sex, well, my first question to anybody that came to me with that problem would probably be, how is your relationship outside of sex? Because sex cannot fix a broken relationship. It is really kind of the glue that holds good relationships together. It is very vital. People with good relationships do usually have good sex, but you can't fix a bad relationship with sex. So if your relationship is not good, if it's broken, if it's just not close, and especially if there's been any sort of abuse or betrayal of trust, addressing that is going to be vital and foundational before you can move on to enjoyment of sex. Obviously, some women say, I'm fine, our relationship's fine, sex still doesn't feel good. There are many physical causes for that. Sometimes, again, sex just isn't working quite right. Most women, like I mentioned, can orgasm quite well, but many women do not with only penetrative sex, only vaginal intercourse. So maybe just what you and your partner are doing isn't quite right for you, and you need to take a little bit of time and back up, talk with your partner, and do a little bit of exploring and figure out what you can do to make sure that both of you enjoy sex. Or maybe there is a medical issue there, and that's definitely something that a physician can work with you through, figuring out if there's a medical problem going on that could be addressed and could resolve the issues. In some women, there is no obvious cause for not wanting or not enjoying sex, and there is a medical diagnosis for that, and it's called hypoactive sexual desire disorder. And that is also treatable. Even in the absence of any of these other treatable things we talked about, you can still treat just low libido, low sex drive. So if you have any of these issues, reaching out for someone to help you, whether it's for physical or mental health, for relationship health, for actual sexual problems, or just low sex drive, all of these things have options for help. And if you need help, please reach out to a physician or a counselor and get the help you need. Some women, beyond not enjoying sex, are actually having pain with sexual activity. And again, this is a thing we don't often talk about, or that women are treated like should just be ignored or gotten over. You know, yeah, sometimes sex hurts and you should just ignore it. You know, you need to do it for your relationship, you know, or your husband deserves sex, you know, why are you not giving it to him? And these are very harmful ways of thinking. If you are having pain with sexual intercourse, please know that that is not normal. It is not something you should ignore, and it is something that can probably be improved. You can get help for. Dyspareunia is the huge doctor word for pain with sexual intercourse, and it is very common, unfortunately, and it is very treatable. There's a wide range of causes for this, and it's something you're going to have to work through with a doctor. But please talk to your family doctor or your gynecologist if you're having pain with sexual intercourse, because there are things that can be done, and it can be an indicator of more serious health problems. So please, please, if you have pain with sexual activity, talk to your doctor about it. Some women have pain even before sexual activity. Any sort of genital or vaginal stimulation causes very painful clenching of the muscles in the pelvic floor and the vagina. That's called vaginismus. And if that's happening to you, again, many women experience that, and it can completely destroy any enjoyment of sex or even prevent sexual intercourse because of the intense vaginal spasms. If that's happening to you, please know that you are not broken. This is not your fault that you can't go through with sex that you wanted to have or that your partner wanted to have. This is a medical problem, and it has good medical treatments. It often is related to trauma in the past, but not always, either physical or emotional trauma. But it can also be related to just pelvic medical conditions. So if you're experiencing vaginismus or any pain with intercourse, please talk with your doctor about it, because there are treatments available for you. Pain with sexual activity can also occur very simply due to lack of adequate lubrication. Anytime there's movement back and forth, there's friction, there's pressure on the tissues there. And fortunately for women, vaginas are meant to be self-lubricating. And in young, healthy women, they usually work just fine. And when a woman's aroused, she has enough of her natural vaginal secretions that's adequate lubrication. But that's not always the case. Around pregnancy or delivery, women who are on hormone pills like contraceptives or hormone replacement, women who have had a hysterectomy or a postmenopausal, for any of those reasons or for many others, may not produce normal vaginal lubrication. And in that case, sex, even great sex that you wanted to have, you were excited about and is in a healthy relationship, can suddenly become very frustratingly uncomfortable, painful, unsatisfying. In that case, fortunately, it's a very easy fix, and the answer is lube. You can get it at any drugstore. There are plenty of good brands. A water-based lubricant is the way to go. So if you are having pain with sexual activity and you've noticed a decrease in vaginal secretions during sex, first thing to try is a simple bottle of water-based lube from the drugstore and see if that makes things better. If it doesn't, then it's time to go to the doctor. All right, next problem is another really common problem that's often swept under the rug, and that is endometriosis. That's a huge word, and all it means is that the tissue that should be inside your uterus or your womb also grows somewhere else in the body. Now, what do we usually call cells that grow abnormally somewhere in the body? That's usually something like cancer. Now, endometriosis is not cancer. I don't want you to get confused about that, but usually we take growth of tissue that shouldn't be there very seriously. Unfortunately, for a lot of women, many healthcare providers have not taken endometriosis seriously. Many women have been left with the impression that this is just a problem with my periods, I just have to live with it. But it's a very common problem. It occurs in 1 out of 10 menstruating women. That's the same frequency as asthma. And think about how many people you know with asthma. So you know that many people with endometriosis, whether they know it or not. Endometriosis, this tissue that grows outside of the uterus where it belongs, causes a lot of severe symptoms. It causes very severe pelvic pain, menstrual irregularities, heavy or irregular periods. It can cause infertility. It can cause very painful sex. It can cause many other problems because that tissue can grow anywhere. It can grow in the abdomen, in the chest. Obviously, you can get stomach and GI problems if it's growing in your belly. If it grows in the lungs, it can cause horrible breathing problems. So this is not something to ignore. The good news is that there are good treatments for endometriosis. So if you've been diagnosed with endometriosis and the impression you got was that you just had to live with it, please talk with your doctor again, because there are so many options. One of the difficult things about endometriosis is that it has to be diagnosed surgically. There's no just blood test or picture we can take. And that's one of the hardest things about it. Your doctor may suspect it, may be pretty sure about it, but to be absolutely certain, they have to do a laparoscopic surgery and look inside your belly and find that tissue that's growing where it shouldn't be. That's really the only way to definitively diagnose endometriosis, and that's one of the reasons it's so underdiagnosed. Hopefully moving forward, we're going to develop better criteria and better testing for this so that we won't have to do surgery on every woman to diagnose it. Again, endometriosis can be difficult to treat, especially because of all the locations that tissue can grow and all of the different ways it can affect women, but there are good treatment options. There are surgical options where they go in and cut out the tissue. The tissue will again recur. The fact that you have endometriosis means you're always going to be at risk for more uterine tissue to grow somewhere else in your body. So it's a lifelong diagnosis even if you had surgery. But there are good surgical treatments for invasive tissue. There are hormonal treatments. Many women do well on things like hormonal oral birth control or other hormone treatments. And then there are other non-hormonal medications, either for women that don't want to take hormones or that are not hormone candidates. So again, if this is something you're struggling with, or if just chronic pelvic pain is something you're struggling with, please talk to your doctor. There are many other causes of pelvic pain as well, and those also really need a workup with your doctor. If you have chronic pelvic pain or endometriosis, I am going to have a couple of links at the end for more information for you. All right, what's the next big issue or big barrier in women's sexual health? The next one I'm going to talk about is pregnancy and birth trauma. Now, pregnancy in and of itself is not a problem per se. It's not a health condition. It's just a state of being. It's a normal thing. But it's a state of being that can cause a lot of stress and strain on a woman and a lot of strain on her sexual wellness. So even the normal changes of a healthy pregnancy often decrease sex drive and cause pain and strain in a woman's body. As you can imagine, there are hormonal changes that can change the condition of your genitals. You have a very enlarged abdomen. You may not be able to enjoy sex positions you liked before. You may feel more tired and just not interested in sex, and all of that is normal. It is normal to have a change in sex drive or a change in sexual enjoyment during pregnancy. That does not mean there's anything wrong with you. If you have issues or things that are causing you distress or concern during your pregnancy and your ability to enjoy sex, then please talk with your OBGYN or your family doc about them, because they may be able to give you pointers, give you tips, give you suggestions for how you can improve things or assess if there's anything the matter, anything that needs treatment. But just normal pregnancy can definitely change a woman's sexual enjoyment for a while. And that's unfortunately one of those things that we do have to live through sometimes. But again, if it's distressing to you, talk with your doctor about options. Normal delivery, vaginal delivery is the most common way of delivering a baby once you got one inside. And a normal vaginal delivery causes enormous wear and tear on the pelvis. You take a structure, the cervix, that was pretty much entirely not open, and you take it to 10 centimeters, which is the size of a dinner plate. The vagina, again, goes from about 3 to 4 centimeters across to 10 centimeters. All of the muscles around it have to stretch enormously. The bones around it even undergo some strain. So even normal, straightforward vaginal delivery causes enormous wear and tear, causes a lot of pain. All of that musculature has to kind of remodel and contract back down during the recovery period. So moms or ladies, if you've been pregnant or if you are pregnant, you absolutely should not be having sex for the first 6 weeks after your delivery, please. Know that your body needs that time to recover. As much as I want you to have sex and enjoy sex, that's not the time. Your pelvis needs time to recover. Even if you feel okay, your body needs that time for you to get better. After that period, or once you've been cleared by your OBGYN for sexual activity, you may still notice changes. And some changes may not be distressing, but some might. You may have pain with intercourse that you didn't have before, especially if you had tearing and there's now scar tissue there. The change in sensation may be significant, or there may be a lot of pain. This is treatable. Muscular strains, tears that have healed with pain, any of that, if you have pelvic pain, and especially pain with intercourse after delivery, there is treatment for that. One of the most excellent treatments is pelvic physical therapy, and we have a couple of excellent pelvic physical therapists here in town. So if you are a mom who's delivered and you're like, I still have pain in my pelvis, it still doesn't feel right, I still can't enjoy sex, talk with your doctor about pelvic physical therapy and say, hey, is that an option for me? This is also an excellent treatment for urinary incontinence that's occurring after pregnancy, or really any time in life. Any woman who has to have a surgical delivery of a pregnancy, either with an episiotomy on a vaginal delivery or with a C-section, obviously then has had direct damage to tissue, has had, a vaginal cut, which can cause some pretty significant damage and a lot of pain and much longer time of recovery, or a cut across your belly that goes through all of your muscles. Every muscle layer in the abdomen is opened up when you have a C-section. It's a major surgery, and I think we don't often give women the credit they deserve for recovering from a cesarean section in just 6 to 8 weeks. We expect them to be kind of moving back into life just fine when they just had a massive open abdominal surgery. So if you are post-cesarean section or like things feel different, things don't feel right, know that that is very understandable and very normal. And you may need time to re-strengthen your core. Your abdominal muscles directly influence your pelvis and your pelvic muscles. The vaginal and pelvic floor muscles are directly related to those abdominal muscles. And even if you didn't push a baby out through your vagina, that doesn't mean it wasn't affected by your cesarean delivery. So again, if you are postpartum, post-delivery, and you're having abdominal or pelvic discomfort, problems with sex, pain with sex, talk with your doctor about it. These are very common and very treatable issues. Another thing that can definitely affect sexuality in postpartum women is postpartum depression. And again, remember how we said 1 in 10 people was how many people have asthma? 1 in 10 mothers get postpartum depression, and it's something we just don't acknowledge enough. So if you are postpartum and you feel like life is suddenly much harder, you aren't happy anymore, you can't bond with your baby right, those are all signs of postpartum depression. Please, please speak to your doctor as soon as you can. This is very treatable, but it's very serious and can cause a lot of misery and dysfunction in every area of your life, including sexually. Good support during pregnancy, during labor, during delivery, and recovery is the biggest factor in a woman doing well, recovering well, feeling close to her partner after labor and delivery, and then not going on to have pain. So, and again, if there are any husbands or boyfriends or partners out there listening, your wife needs your support during her pregnancy, her labor, her delivery, and that's really going to be key in y'all having an excellent sexual relationship going forward. Again, pelvic physical therapy is my first line recommendation for women who are postpartum and are still having pelvic pain, discomfort, pain with sex, incontinence. It's very effective for all of those things. And again, if you are after your 6-week postpartum follow-up and you are having pelvic pain or pain during intercourse, please, please either go back to your OBGYN or call up your primary care doctor and talk with them about this because it's very treatable. All right, at the other end, or sort of the life spectrum for women is menopause. I say at the other end, but really, most women spend about 1/3 of their life either in menopause or postmenopausal. So this is a huge part of your life, ladies, and we want to be able to have good sexual health during it. Menopause occurs when a woman has a decrease in ovarian function that causes decreased estrogen levels. This changes just about every aspect of her body and is a huge, huge change. It is, again, a physiologic change. It's something we expect and is normal, but that doesn't mean that the symptoms go with it sometimes are normal or acceptable. Some women have a decreased sex drive or a decreased libido just from menopause. And again, ladies, that is treatable. Other women don't experience that. That's definitely not universal, that to have a decreased sex drive. But if you are experiencing it, it can be a normal variant of menopause and can be treated if it's bothering you. Much more common are hot flashes and mood swings. Over 70% of women, most women really at some point will experience one of those symptoms with menopause. And then menopause is defined by not having a period for a year. So not having a menstrual cycle for a year, then you've gone into menopause. So this has so many effects on the body. It changes your bone density. Ladies, that's why we start doing bone scans once you've gone through menopause a few years later. It changes your muscle composition, changes your hormones in your body, and it changes your genitals. The lack of estrogen does decrease vaginal lubrication and start to thin the tissues of the external genitals, the vulva, the vagina. So that is one of the most common causes of painful sex in women is just menopause. And it's because the tissues there have become much more thin, much more easily bruised or torn or scraped, and there's much less natural lubrication. Starting with natural lubrication is usually the way we treat that. Again, lube, or if that's not adequate, there are over-the-counter vaginal suppositories that you can use every day to start providing more moisture naturally. And again, if those aren't adequate, we move on to other treatments to help replenish the vaginal tissues and the moisture there. There are so many good treatment options for this. So if you are menopausal or having menopause symptoms and they are bothering you, please talk to your doctor because we have a lot of excellent options. Often our first line, or the first thing we think about at least, is hormone replacement therapy. And in any women who are young and are menopausal because of, for example, a hysterectomy, this is often a very good option because early menopause is a risk factor for a lot of problems, including things like dementia, bone disease, and osteoporosis. So being without that estrogen for a longer period of time can increase your risk factors from some health problems. So especially in younger women, but really in any woman with menopausal problems, we often consider hormone replacement therapy. Now, hormone replacement therapy is not entirely risk-free, so it's always a discussion between the physician and the patient about what the patient's individual risks are, what her needs are, and whether or not hormone replacement therapy is the right fit for you. So if your doctor says, no, you really shouldn't have hormone replacement therapy, know that they're not withholding something good from you. It's because they looked at you, at all your needs and all your risks, and said, this is too high risk, or I really don't think this is going to be helpful for the symptoms you're having. But if you are menopausal, if you're having menopause symptoms, hormone replacement therapy is likely one thing your doctor will talk with you about. There are many other medications, though, that are non-hormonal for women either that don't want hormones, that are not candidates for hormones, or whose symptoms do not respond to hormones. There are other non-hormonal medications that are very effective for menopausal symptoms. Everything from hot flashes to sexual dysfunction to just vaginal dryness. There's treatments for all of those aspects of it. So please talk with your doctor and see what your options are for that. Before you go to your doctor, if you're like, I don't know if this is bad enough, you said menopause happens to everybody and I don't know if I need to go to my doctor yet. There are many good lifestyle tweaks and changes you can make to help you deal with the symptoms of menopause. And we are going to talk about a bunch of those in a little bit. So if you're not ready to go to the doctor just yet, there are lifestyle changes you can make. But if you are having menopause symptoms and they are causing you distress, causing you problems in your relationship, then it's time. You should go to the doctor and you should talk with your doctor about this because they can help. All right. The next barrier to women's sexual health is a little bit heavy, but I think it's very important that we talk about it today, and that is intimate partner violence. What is intimate partner violence? Intimate partner violence is physical violence, sexual violence, stalking, or psychological aggression by a current or former intimate partner. So that means anything, basically, that your intimate partner does to you that makes you feel unsafe or that injures you. This is a huge problem. I know I've talked about things that are common. This is more common. 1 out of 4 women will experience violence at the hands of her partner in her lifetime. And so I know that means that women today that are listening have experienced this. And I want you to know that you did not deserve what happened to you, and you are not alone. And if you need help, there is help for you. No amount or type of abuse is acceptable in your intimate relationship. Many women feel like they can't justify separating or can't justify asking for help because he only yells at me sometimes, or he only slapped me or only pushed me, he didn't punch me, or he only did it the one time when he was drunk. And I want to say it again very, very clearly. No amount of harming you, of threatening you, of making you feel hurt and unloved is acceptable in your intimate partner relationship. And if you are experiencing those things, please, please, again, know that this is not your fault, but that it is up to you to decide that you don't have to stand for it, that you're going to get help, and that you can leave. There are a lot of warning signs of abusive relationships that happen up to and including violence. Someone who humiliates you or yells at you, someone who tries to manipulate you or force you to do things you don't want to do, or tries to set standards that you don't even understand. You say, I don't even know how to please them. Someone who blames you for mistakes they made or problems they've created. Someone who does something to you and then denies it and says, you're just too sensitive. These are all warning signs for abuse. And again, if any of these things resonate with you and you're like, well, I never would have called my relationship abusive, but now that we're saying these things, you're like, well, yeah, that does happen. Please know that you don't have to put up with this, and that what you're describing is not just a warning sign of abuse. That is abuse, whether it's physical or emotional or sexual. If you are abused, again, there is help. Please reach out for help. We have an excellent women's shelter and women's helpline here in Lake Charles. Oasis, a safe haven for survivors, is a domestic and sexual violence shelter and helpline. I've got their number right here on the screen, and I'm going to stay here on this slide for just a minute. This is their domestic violence hotline number and their support line that you can call 24/7, even if you just want to talk. Even if you say, I'm not sure if what I'm going through is abusive, or I'm not sure if I should leave. I don't think I have options to leave. I'm not sure what to do. This is a support line you can call at any time, and a trained helper, a trained person will talk you through what's going on, talk you through what your options are, help support you, help provide you with the information you need. There is an excellent website also, oasissafehaven.org. And again, I'm going to leave this on the screen for just a second more, but then the link is also going to be in the comments below, both now and at the end of our talk. So I'm going to say it one more time. If you are experiencing anything in your relationship that makes you feel unsafe, makes you feel frightened of your partner, or any amount of physical aggression, please get help today. Moving on, another barrier to women's sexual health is chronic illness. And this is chronic illness in any form. Like we mentioned at the beginning, physical health is one of the biggest predictors of sexual well-being. So any type of chronic physical condition can impact your sexual wellness. Things like diabetes, heart disease, arthritis, chronic bowel problems, chronic pain of any kind, all strongly impact your sex life. Both on the physical side, because normal sexual function requires healthy blood vessels, healthy nerves, healthy muscles, and because of the mental load they carry with them. So for instance, if you're a diabetic and over time your high blood sugars have damaged the nerves that go to your feet, guess what other nerves they've damaged? They've damaged the nerves that go to your pelvis and your genitals too. So if you're having sexual dysfunction as someone with diabetes, there's a very real chance that your diabetes is impacting it. Women with arthritis may have trouble getting into sex positions they once enjoyed, or the sex positions that their partners want. Even people who say, I don't really see a direct correlation. I've got a chronic illness, but I don't see how it directly impacts my sex life. Just the weight of carrying a chronic illness day after day can really impact both you and your partner. And so even if you don't see a direct relationship between your chronic illness, if you are having sex dysfunction or relationship dysfunction, I would say that's definitely something to consider, and something, again, that therapy can help you explore with your partner if needed. For other chronic illnesses and their impact on your sex life, treating the chronic illness adequately is going to be the first step, and then addressing any symptoms it has with the impacts on your sex life is going to be the next. Both of those you're going to need to work with your doctor on. One of the chronic illnesses or serious illnesses that can significantly impact sexuality in a woman's sex life is cancer. Cancer is unfortunately extremely common. In the U.S., almost 912,930 women were diagnosed with cancer last year in 2020. And many of those were breast cancer, lung cancer, thyroid cancer, cervical and uterine cancer. And obviously, cancer in and of itself is just a shattering diagnosis. It's the C word to many people. It's something they can't even contemplate. And so just the diagnosis of cancer itself can cause so much mental and emotional distress that your sex life is shot. Your sex drive goes out the window. You're not interested. You've got this crisis going on. How could you be interested in sex when you've got this on your mind all the time? Cancer treatment can be very invasive. It can be very uncomfortable, even painful. It can be very physically demanding. It often causes permanent physical changes. A woman who has breast cancer may have to have a mastectomy. A woman who has cervical or vaginal cancer may have to have part of her pelvis removed. Her vagina may never be the same. A woman even who has colon cancer may have to have a colon resection. And now you may have an ostomy bag and say, I don't know how I can go on having a sex life with this here. Those are very normal responses to cancer. Even if you got through your cancer treatment and said, I guess I was fine, sexual effects of cancer may not appear till downstream. The effects of chemotherapy, radiation, and surgery may still be appearing and evolving over the several years as the cancer survivor moves out from their treatment. So please know that your cancer diagnosis is very relevant to your sexuality, even over the rest of your life. If you are a cancer patient, if you're a cancer survivor, please talk with your cancer team about any sexual concerns you have and any sexual side effects you're experiencing from your treatment. If you need further help, please know that there is help out there. If you're a Memorial patient, we are actually working on setting up a sexual wellness clinic over here at Astor Street for all cancer patients and for any other community patients that need further help with their sexual wellness during their treatment. Another barrier to women's sexual health, and one that I think again is never talked about, is something that's kind of hard to acknowledge, but it's very important, and that is that through the years, the medical community has failed women a lot, especially in reference to their sexual wellness. Women have not been used for the frame of reference for medicine for a long time. Most research was done on men. Most understanding of biology was based on men. Fortunately, I think we're making really good changes in that direction. Over the last 20 years, a lot of legislation has been passed that says women have to be included in medical trials, which was not usually the case previously. Women were not included in medication trials. But now going forward, that is more and more has to be the case, which is an excellent victory for women's health. More and more we have people championing women's health and doing research into how things particularly impact women, because men and women are biologically different. We're not quite the same. We have the same needs in many ways and the same rights, but biologically we're different and things impact us differently. Medications and treatments impact us differently, and women need research and need health care that focuses on their unique biology. So in the past, unfortunately, that hasn't been the case, and I know many of you may have experienced both a lack of knowledge about women's health in providers you've seen before, and sometimes even a bias against women. I know I mentioned at the beginning we weren't going to get into a lot of the social or political issues surrounding gender or women, but bias against women is real in many ways in life. And bias of providers against women has been real in medicine for a long time, unfortunately. And if you've encountered that before, if you've encountered a provider that you really felt like dismissed you because you're a woman or dismissed you because of your complaints were only something to do with women's health, then I'm very sorry about how our profession has let you down. I'm hopeful that things are changing for the better and that going forward you will be able to find providers who really care about you, who hear you, and who work with you to achieve your best health. When you are working with your doctor, most of the change there in this barrier is on doctors and on the medical field, and we need to improve and we need to be better. The thing that you can do to make sure that you get the best possible care is to work with your doctor as your own advocate. Make sure that you are finding a doctor that's a good fit for you. If you don't feel respected and well treated with your doctor, then find a different doctor. Tell your doctor what's going on. We are not mind readers for sure, and we work within a lot of time and space limitations often, so make sure you're communicating your symptoms and your needs to your doctor. Make sure that if something doesn't work for you, if your doctor suggests a treatment and it doesn't work, make sure you tell them. Make sure that that may not have been the only treatment available. They probably didn't mean for you to go on suffering if it didn't work. But if you don't come back and say, hey doc, this didn't work, what's our next step? Then they don't ever know. And they may not ever remember to circle back and say, did that work for you, or do we need to try something else? So make sure that you advocate for yourself, that you talk about what your issues are, and that you keep talking about them if they're not getting better. And again, if you find that you're with a doctor who dismisses your problems, you say, I'm having pain with intercourse. They say, here, try this. It doesn't work. And then they say, well, I don't have any other ideas. There's nothing else to do for you. Unfortunately, you may have met one of the gaps or failures in the medical system, and please advocate for yourself. Ask again, are you sure there's nothing else we can try? Or consider following up with a different doctor if you have to. All right, guys, that's all the barriers to women's sexual health I'm going to address today. It is by no means all of them. There are many others. And if you are experiencing something we didn't talk about today, please know that doesn't mean you're not important, and please seek help for it. Now I'm going to move on to something that I think we'll all enjoy, sexual health pearls and pointers, little tips and things you can try starting today to improve your sexual wellness. All right, the first one, and one of the most important in my opinion, is to take your time. Take time with your partner. Take time where there's no stress on either of you, or as little stress as you can manage, to really figure out what you're enjoying in intimacy. This can be really difficult if you have been with your partner for a while, especially if you're not a very demanding person, not used to telling your partner what you need or what you like. You've been together a long time. You're in a groove, but maybe it's not a good groove for you. you're not enjoying sex or not enjoying it as much as you'd like to. Maybe you're not reaching orgasm when you have intercourse with your husband or partner. It's going to be really tough to have this discussion, but it is so important to talk with them about what's going on and to say, can we take some time? Can we back up and see if we can figure out how I can enjoy what we're doing together? And then taking that time together, taking the pressure off of both of you, saying, this is not a box we have to check. We don't have to have sex twice a week to make sure our marriage is okay. Let's just take time and enjoy being together. Let's try to figure out how we can enjoy each other together. And that can really change your relationship, both emotionally and sexually, for the better. Women also, I mentioned at the beginning, take time to progress through arousal, from desire to arousal to orgasm. I kind of mentioned that very briefly in the incorrect thinking at the beginning, but all human beings, when they have a sexual experience, go from sexual desire to sexual arousal to orgasm. Or they don't, but that's the correct and natural progression. And to have a satisfactory, complete sexual experience, that's the needed progression. You can't just get to orgasm without the other two steps. So ladies, if you're having sex with your partner and you're like, yeah, I never orgasm, well, make sure you're taking the time to get excited. Even if you say, I'm not always excited about sex when we get started, make sure that you're getting excited during it at some point, or else what you're doing isn't working for you yet, and maybe you need to just talk with your partner more, or maybe you need help in other ways. But for today, try taking your time, try slowing down, and talk with your partner. Again, it can be really hard to bring up sexual topics with our partners, but it's one of the best things we can do. One of the sexiest things we can do is to talk about what we need in sex, and to be honest about it. So I challenge you, if you're really not happy with where you're at sexually, talk with your partner about it and talk about how you can slow down and take time to figure out what you need in your sexual relationship and how you can both have a better relationship. Make sure to be truthful when you do that. Sometimes women feel pressured to act like they're enjoying sex or to let their partner think they're enjoying sex when they're not. And I understand if you've done that, you wanted your partner to be happy, you wanted him to enjoy what you were doing, you wanted him to feel like a good lover. But faking what's happening, faking orgasm, faking enjoyment, really steals the opportunity from him to actually have a good sexual connection with you. If you've been doing that for a while, this can be an extremely difficult conversation. And maybe I wouldn't tell your husband of 20 years that you've been faking every orgasm, but it would be appropriate to say, I think I could enjoy our sexual relationship more. Do you think we could slow down? Do you think we could try different things? And I'm going to be really honest with you going forward about what feels good and what doesn't. When you're having a sexual relationship, make sure you're doing it in a safe and healthy way. Prevent the transmission of sexual diseases. If you are in a monogamous relationship with a person who is known not to have sexual diseases, then you can probably dispense with condoms. There's always, unfortunately, because we're people and people sometimes mess up, the chance of infidelity and sexually transmitted infection. However, if you feel safe and confident with your partner in a monogamous relationship, you may not need condoms. Everybody else needs to use condoms, either male or female condoms, for the prevention of sexually transmitted infections. If you have been having unprotected intercourse or any sexual contact unprotected, then I strongly recommend getting tested. And then if you have any symptoms, please don't wait. Don't see if it's going to clear up on its own. Go to your doctor or to the health department and get tested and get treated. The health department here in Lake Charles does offer sexually transmitted infection testing. They offer pregnancy tests, they offer condoms and other forms of birth control, and they offer treatment for sexually transmitted infections. So if you don't have or can't get to a primary care doctor, you can get to the health department here in town for help with that, and we will have a link to their website below. Again, we mentioned that contraception and fertility are an integral part of female wellness, so have a plan for fertility and for contraception if you need it. The average woman, if she has sex regularly, at least once a week for a year, will become pregnant. 9 out of 10 women who do that are going to become pregnant. So if you are having sex, if you're having vaginal intercourse, and you have no plan for contraception, what you're doing is you're planning for a baby. You just haven't realized it yet. More than 50%, or right about 50% of pregnancies in America are unplanned. That doesn't mean unwanted, but just that they weren't planned for when they happened. So it can happen to you. It will probably happen to you if you keep having unprotected intercourse without any sort of contraceptive. If you want to get pregnant, then that's excellent news. If you want to get pregnant and are struggling with infertility, please know that that is also an important part of women's health. We didn't talk about it today, but that doesn't mean it's unimportant. And if you are struggling with infertility, please speak to your doctor, because there are so many good medical options for infertility. So if you've been trying for more than a year to get pregnant and you're not where you want to be, please do talk to your doctor about that. But for everyone else who's not trying to get pregnant today, know that some plan for contraception is important. I understand that many people listening to me may not be on board with using many forms of contraception, such as oral contraceptive pills or anything. And that's all right. There are options for everybody within your belief system, within your needs for your body. Some of the options that are very popular, such as the pull-out method or just the fertility cycle awareness, do work much better than nothing. They do. But they do not work as effectively as things like oral contraceptive pills or condoms. They're about maybe 75 to 80% effective. And what that means in reality is 2 to 3 women out of 10 who use them are going to get pregnant. So if it's very important to you not to get pregnant right now, the pull-out method or just trying to fertility track is not a good choice. Please talk to your doctor or the health department about other options. There are an enormous range of options for birth control. Hormonal, non-hormonal, pills, patches, rings, inserts, so many options. I do all of those at my office. If you need a doctor to help you make a choice with one, they do pretty much all of those at the health department. And probably your doctor, primary care, or OBGYN can help you with any of them also. Mentioning almost half of U.S. pregnancies are unexpected. If you're an adult woman who's menstruating, then you should take a prenatal multivitamin. I know you can be like, wait a minute, what? Prenatal vitamins are for pregnant ladies? No, ladies. Prenatal vitamins are for everybody. They are going to help improve your wellness overall. The vitamins found in a multivitamin are really beneficial to just about everybody. They fill gaps in our American diet. We get plenty of calories. We don't always get the nutrients we need. So a multivitamin is good for everybody. And a prenatal multivitamin, with its higher concentrations of folic acid and iron, can help prevent serious birth defects. Neural tube defects are some of the most serious birth defects, and they're pretty much completely preventable with women having adequate folic acid in their diet before pregnancy. Doesn't do any good if you start it after pregnancy. So if you're an adult menstruating female, even if you're not planning a pregnancy, remember those 45% of pregnancies that are unplanned, even if you're not sexually active, because unfortunately such things as accidents, unplanned sexual activity, and rape do happen, I recommend that every adult woman be on a prenatal vitamin. The iron in it's great for preventing anemia. So again, in pregnancy, anemia is one of the huge problems, and it helps prevent other adverse outcomes in pregnancy if women are taking a prenatal vitamin before they become pregnant. All right, back to menopause. I know I mentioned we'd circle back to this and talk about some of the lifestyle tips you can use to help you deal with your symptoms at home. Hot flashes are one of the most common problematic symptoms of menopause that women need help with. Over 70% of women have hot flashes as they go through menopause at some point. And these are pretty manageable for a lot of women with just lifestyle modifications. Some of the things I'm going to say sound obvious, but a lot of times things we need to try sound obvious. So make sure you're trying them and see if they help. Wear layers of breathable clothing. Don't wear clothes that are like polyester or other things that don't breathe well, that doesn't get any airflow. Silk would be similar in some ways. Wear things like cotton or other things that have lots of good airflow through them, and wear them in thin layers. Don't wear a heavy wool sweater, ladies, even if it's winter outside. If you know that you're prone to hot flashes, you can't get that thing off fast enough when one hits. Wear thin layers. Wear lots of them. Wear as many as you need for the weather outside, but especially as we get towards the hot weather outside. You know, wear thin cotton tank tops layered under a thin cotton shirt. With a light sweater if you need it, that you can take off quickly. Because being able to take off layers quickly if you start heating up is one of the best ways of dealing with the hot flash. Avoid hot flashes as much as you can by avoiding triggers. Just like migraines or many other problems, hot flashes often have triggers, and they may be very individual to the person, but they're often very trackable. So if you track your hot flashes, you'll often find what your triggers are. Some of the very common ones are spicy foods, and I know down here in Louisiana, you're like, well, how am I going to avoid that? But if you notice that that's a big trigger for you, you may at least be able to be ready. When you say, yep, I'm gonna eat the crawfish tonight anyway, you can at least be ready in your tank top with your fan and your ice water or something. Caffeine and alcohol are two other huge triggers for women. So just be aware, even if it's not something you think you can completely avoid, you can be aware of what's happening in your body and you can know how it's gonna affect you. You can plan for avoiding it or for dealing with hot flashes when they happen. Hydrating with cool drinks, especially water, but really any iced drink can help a lot once a hot flash hits. Obviously you're hot and cooling off is a good thing. So fans, but especially the water, because the hydration tends to decrease the intensity of the hot flash. Cooling off with ice cold water is really very helpful. Some studies even show that women that have a lot of hot flashes at night, if they drink a glass of ice water right as they get into bed, they decrease the frequency of hot flashes at night. And the same note, for in your bed, make sure you have thin layers of bedding. If you have a down comforter, take it off. If your husband's a cold sleeper, get him a smaller blanket for his side of the bed only. Have a sheet and maybe one, or if it's cold in your house and you like warm blankets, have a couple layers on that you can throw off if you hit a hot flash in the middle of the night, so that you can stay comfortable in your own space. And when you do have a hot flash hit, one of the best ways of dealing with hot flashes, other than hydration and taking off extra layers, is actually mindfulness, is working through and breathing through your own response to the hot flash. Because often like a stress response or an emotional response to a hot flash makes it much worse. So relaxing breathing, meditation, or yoga that you start practicing every time you have a hot flash can decrease the severity of hot flashes and decrease their frequency, because there's some connection between your emotional state, your physical state. Like I said, there's triggers. Anxiety and stress can be another trigger for hot flashes. Kind of working on all of those aspects, your environment, your own thinking, your own body, can really help you to control those hot flashes on your own without the need for medicine. However, if after trying lifestyle changes you really are still having problems with hot flashes, do talk to your doctor, because there are excellent medication options available. That brings me back to one of my biggest tips is when you need help, please get help. There is help available. Talk with your doctor. I think we should be one of your biggest advocates for your sexual wellness. You deserve to have a fulfilling and happy and enjoyable sexual life. And most of the problems that women encounter in their sexual life, they may feel insurmountable, they may feel embarrassing, they may feel like they're your fault, but they're not. They're medical problems, they're emotional or mental problems, just like any other, and they're very treatable. So please, if you have a primary care doctor that you trust or an OBGYN that you trust, talk with them. Make an appointment and talk with them about it. It may be uncomfortable to talk to the front desk and say, hey, I got to come in because I am not enjoying sex. And so your doctor will understand if you just say, I'm having a problem and I need to talk to you. It'll be all right. Doctors have heard worse than whatever you're going to tell them, I promise. If you don't have a doctor that you trust, if you're like, yeah, but I can't talk to my doctor, I don't have a doctor, let me point out to you a couple doctors. I'm, like I said, Dr. Groves. I'm new at the Astor Street Memorial Medical Group, and I'm taking patients. I both take primary care patients who I'm glad to work with on any of their sexual problems. And if you have a primary care doctor already, and you'd really like to stay with them, but you're not sure you can talk with them about this, or as a woman, it's a man, and you don't want to talk to him about it, or for any other reason, I also do take consults for women's sexual health. And I'll be glad to work with you through your issues and then send you right back to your primary care doctor for all your other needs. Another women's health and family medicine doctor here with Memorial is Dr. Deanna Degrapont. She's out at the Memorial campus out on Gautier Road. She's doing excellent work out there. She's also taking patients, and I've got her office number on this slide too. So either of us would be happy to see you and work with you to work through all of your health needs, including your sexual health. If you've listened with me so far, thanks so much. Hopefully you've learned a lot today, but here are some more resources if you would like to keep learning at home. When you learn about sexual health, I strongly encourage you to use reputable sources. Everybody has got something to say about sex on the internet, and a lot of it's not true. So make sure that the resources you use are reliable. The ones I've got here today are very reliable. If you just want more general information about women's sexual health, I strongly recommend both the Mayo Clinic and Harvard Health's pages on women's sexual health. If you want to just Google them, Harvard Health, Women's Sexual Health, it'll come up, but we are going to have a link below for you. If you're a woman with endometriosis or chronic pelvic pain, there are some excellent resources for you. Pelvicpain.org is very good. It has a lot of resources and a lot of information that you can go through. There's also a good link to a site about endometriosis that'll be below. If you are a woman with cancer and you say, I'm not even sure where to start with thinking about my sex life, the American Cancer Society has an incredible set of pages for information about the adult female and her sexual health during cancer. So go take a look there. We'll have a link below. If you are a woman who just says, I'm not sure that this is a medical problem yet, maybe I need to do some work in my relationship or in my thinking about sex, what else, where could I start with that? There is a really wonderful book that I have read and enjoyed and that I recommend. It's called The Great Sex Rescue. It's by Sheila Grigor, and it's available on Amazon or any other booksellers. There's also a blog by the same author called To Love, Honor, and Vacuum. I don't think we have the link to that one, but I'm pretty sure that's the right name. It's an excellent blog on a lot of women's health and sexuality topics, but this book in particular, The Great Sex Rescue, is a really great resource for people who want to work through their thinking about sex and their relationship with their partner and their sexual wellness together. All right. That's about all I've got for today. All the things I talked about today and all the statistics and everything else, again, I mentioned using reputable resources. These all come from different scientific studies and scientific resources, and here's all the sources I pulled them from, just so you can know that I'm not pulling stuff out of the air to tell to you today. All right, I hope we've got some questions today, so I'm going to see what Miss Allie has that y'all have put in the comments below.
Yeah, so one of the questions that came in says, in regards to relationship advice pertaining to this particular topic, who would you recommend speaking to?
All right, so it's really going to depend on your problem to start with. If you are not in a safe relationship, if you feel like your partner is in any way making you feel unsafe, whether or not you're willing to label it abuse, then I would call the help number we listed for OASIS. However, if you are in a safe relationship, that's a completely different question. And it's going to depend a lot on you, on your relationship, on your setting and your social support. If you feel like you and your partner just need to do a little bit of improving, the very first person to talk to is your partner. Make sure that you're connecting with them and letting them know that there's a problem. Y'all should be a team moving forward together, and you can never work together if you're not communicating that something's wrong and it needs fixing. From there, moving forward, there are a lot of options. My recommendation would be a licensed counselor or therapist. We have many good therapists in the area. If you go to Psychology Today or even just Google counselor Lake Charles, huge lists will come up and they'll talk about their area of expertise. There are a lot of really good counselors in Lake Charles. If you want more help picking one, your doctor can work with you on choosing one. If you're a religious person, you may choose to go to your pastor or priest first. Please know that I hope these people will give you excellent support and good advice. And I hope that you trust them and have a good relationship with them, but they may not be thinking first and foremost about your sexual health. And that's not their job. So I would strongly recommend seeking help with a licensed counselor or therapist. And again, if you need help finding one, please reach out to your doctor.
The next question is, how long is it okay to be on birth control pills?
If you don't have a problem that means you need to be off of them, then all of your reproductive life is just fine. Now, there are women who should not be on birth control pills. So as long as you've worked with your doctor on whether or not it's safe for you to be on birth control pills, if they say you don't have any reason that you have to be off of birth control pills, then you can stay on them your whole reproductive life. The entire time you're menstruating is just fine.
And one last question. How soon should I start talking about this and seek professional help after a cancer diagnosis?
All right, so if you are a cancer survivor, and by that I mean from your day of diagnosis forward, if you've got cancer, you're a cancer survivor because you're still listening, then it's really reasonable to seek some support and help for this as soon as you want to. Like I mentioned, sometimes in the first rush of dealing with a cancer diagnosis, your sexuality is the farthest thing from your mind. But whenever you're ready, it's time to talk with your doctor about it. It's always reasonable from the very beginning to ask your cancer team, your oncologist, your surgeon, every doctor involved, how is this going to impact my sex life moving forward? What kind of impacts is this surgery, this chemo, this radiation going to have on me going forward? And it's reasonable to talk through that with them, and then to seek further help. If you've started to have symptoms or impacts on your sexual life, then it's definitely time. Call up today and get some help.